Hello to the Argos community. Hi, I'm Ned Spiker, Superintendent of Argos Community Schools, and I'm here to share a very important message with the Argos community, our Argos students, our Argos parents, our Argos teachers, faculty, and staff on a roadmap to reopen Argos schools. The one thing that we're very sure of is we give you an initial roadmap to open our schools, that things keep changing. Our situation in our society and our culture of the COVID-19 emergency is ever changing. So the information we share today is the best information we have as of today and have as we're recording this today. But we want to assure you that things will change and continue to change. And two words we want to follow at Argos schools is that we want to be flexible to meet people's needs. We want to accommodate people's needs. And we want to change and continue to change to be safe for all our students, faculty, and staff. Since March 13th, which was our last day of school, we have been working hard and our society has been struggling to overcome this COVID-19 emergency. And we have formed an Argos Schools leadership team of all the directors, the administrators, the principals, the school board, myself, and leaders of various departments on developing a safe plan to reopen Argos Community Schools. We've also been working weekly with the Marshall County Superintendents, the Marshall County Department of Health. We've been working also weekly with the state of Indiana and following the guidance of the CDC, the Center of Disease Control. All this as we develop the best possible roadmap to a safe reopening of Argos Community Schools. With that said, I'd like to walk you through a roadmap, and we will be posting this on our website for the days to come for you to watch and get information whenever needed. And we will also have our questions site up and going, and we will answer questions from the community. But I do want to stress two words to you again. Argos Community Schools wants to be flexible and wants to accommodate to meet your needs and your children's needs as we reopen our schools. First and foremost, we want to reopen them safely for all students, staff, and the community. This Argos plan that we're going to share at this time is contingent upon Governor Eric Holcomb of the state of Indiana moving the state into stage 5 on its safe reopening plan in early July as projected. This will continue to change this plan as conditions in our state of Indiana and Marshall County change. The first thing we want to talk about is that Indiana has put out a plan for learning in safe schools. It's called the In-Class, Indiana Class Document Link. That link will be on our website so you can get more details about this plan. As addressed in this plan, Argos schools will be constantly evaluating on two key factors: Argos schools' ability to maintain a safe and healthy environment, and the prevalence of COVID-19 in our community and in Marshall County. Revisions of this document are expected as we move forward. As we plan for this new school year to begin, we are planning for the new school year to start on schedule with in-person classroom instruction, and the first day of school is scheduled to be August 6th. 2020. We anticipate as we move forward a normal 180 days of instruction school year for 2021, but we will continue to review these policies and procedures to provide flexibility and remove any punitive measures for absences when there's a determined illness, a local outbreak in our community, or if any of us have exposure to a contagious disease. Using this preparedness plan, we will establish predetermined thresholds for strategies if there are cases in our schools or in our community or in our county. Need to share with you all our schools have been thoroughly cleaned, will be thoroughly cleaned, and to help prevent community and school spread. The superintendent will be provided with health reports, and I will be receiving those as necessary to review with the Marshall County Health Department on a regular basis. We're going to track data, reasons for students' absence and staff absences. We'll track positive cases of COVID-19 in the schools, and we'll also be looking at data in our county and the state of Indiana. We are doing extensive training with our staff for screening procedures to help identify symptoms which need to be addressed. Students and staff daily schedules will be adjusted to provide adequate time for hand washing, sanitizing of desks, sanitizing frequently touched objects, sanitizing distancing practices will be put in place, and other good hygiene practices will be implemented. These will include the following, but certainly not limited to these. The school nurse clinic will develop additional safety procedures to minimize infection. Our extracurricular and co-curricular reentry guidelines are being developed with the state of Indiana and the Indiana High School Athletic Association. That way our extracurriculars can take place in a safe way, reducing the risk of disease. Relevant training will be provided for our certified staff and non-certified staff and our substitute teachers to address a variety of COVID-19 related issues such as symptoms, remote learning methods, remediation, and addressing the academic loss of learning that happened this past spring as we tried to conclude school successfully. We'll also be providing mental health training for our staff and assistance for our students that have existed due to this pandemic. Our custodial staff is being trained on effective methods of cleaning and disinfecting all work and play areas and the time schedules for cleaning. Our visitor policy will be adjusted to reduce the number of additional people in our schools, and thereby reducing the number of students and staff exposed to illness. Our Argos Schools website will regularly provide updates for students, parents, and stakeholders. In addition, we will continue to share information in many different ways to keep everyone informed to keep us as safe as possible. The number one topic in the first slide we'll be looking at is health and home, stopping the spread. What can we do at home, and what can we do to stop the spread of this contagious disease? As we're stopping the spread of this contagious disease, how do we provide a quality education for all of our students? So some preventative measures. Argos families can help stop the spread of COVID-19 by stressing good hygiene at home. First and foremost, good hygiene at home is really important. Hand washing, avoiding touching your face, eyes, nose, or mouth are important steps a person can take to avoid becoming sick. Families are encouraged to stress to their children thorough hand washing for at least 20 seconds and covering coughs or sneezes with the inside of the elbow if facial tissues are not available. State statute gives public school districts the authority to exclude students who have a contagious disease or have symptoms and are liable to transmit exposure to other students. Argos schools will be following these state guidelines. Symptoms impacting consideration for exclusion from school. We'll give these symptoms to you now. It's not every symptom, but we should learn to self-screen ourselves and our children and people coming into the schools for COVID-19 related symptoms. Some of the symptoms we'll be screening for are this: a fever of 100.4 or greater, persistent cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, and a new loss of taste or smell. Students and employees should not enter the buildings if they have these signs, and if they come with these signs or these signs are discovered at schools, we will ask and we will take steps for these students to stay home until they feel better. Argos schools will also be screening and may legally ask a parent whether a student is exhibiting any signs. So this first step of personal screening is really important as we try to make our schools as safe as possible as we reopen to not infect students or staff. Returning to school after an exclusion will be based on some guidelines that is set by the County Department of Health and the State Department of Health and the Center for Disease Control. If a person is untested but had some signs and we send them home and they are excluded for some time, a person with a fever that we have identified, our old fever policy was 24 hours fever-free. The new policy, until further notice, is a fever-free for 72 hours and at least 10 days of symptom-free before a student or a staff member returns to school. If an employee or a student tests positive, and there will be a period of 14 days until symptoms are gone and the healthy person can return to school. People that test negative and not had a fever for 72 hours with a doctor's note can come back to school. If somebody in your household tests positive, but our student or our employee is not testing positive, we recommend a self-quarantine for 14 days to be as safe as possible for your family, your children, and our staff and students. Because of our stressing that people stay home when they're not feeling well and be safe and take time, we will be removing all attendance boards at this time until further notice. We don't in any way want to encourage anyone to attend school when they're having these symptoms. Next step that I'd like to address is in the school building itself, and look at health in our school building, protecting our school community in Argos Community Schools. As I said before, Argos Community Schools, through myself, the superintendent, will be tracking cases of COVID-19 in our community, along with cooperation and the assistance of the Marshall County Health Department, to make determinations how do we best protect our Argos children, our Argos staff, and our Argos community. So we will have some screenings. Every morning when we first come to school, students will report to a homeroom, and we will do some initial screenings to make sure that everyone is healthy and ready for the day of school. But if a parent tells the district that a student is ill, we will ask the parent whether the student is having symptoms or somebody else in the family is sick. And if an employee calls in sick, we will be doing some follow-up. If a person is obviously ill, the school district will exclude the child or the adult from school until they are feeling better again. We are going to have some new clinic space for people that are showing symptoms at school. We will put them in an isolation clinic. They will be working with the school nurses for further screening, and then we will be contacting home. We will not let them in our regular nurses clinics, and now we will have separate isolation clinics until we figure what's going on in the sickness. And if anyone has a fever of 100.4, as we said before, they will be excluded for 72 hours of fever-free time before they come back. We will have a school preparedness plan that will address steps in how to make our schools as healthy as possible. If we do get a confirmed COVID-19 situation on schools property or on schools grounds, we will contact immediately the Marshall County Department of Health, the family and the people involved, and we will also quarantine, isolate people that were in close contact with the person that tested positive, and we'll immediately deep clean and disinfect all areas of the school these people came in contact with. Another area that we're going to be implementing is dealing with mental health issues. We know that many of our children, many of our students are anxious, have been anxious through this. We know many of our adults are anxious and our family members. We will be implementing some additional mental health strategies to help our community and our students and our employees deal with mental health issues that could come up during this crisis. The next area we are going to be addressing is in our school building again, with health at school, looking at our classroom and looking at our learning situation with our students. Number one and foremost is safe at school. At Argos, we're going to employ flexible policies, and we're going to accommodate students and staff to keep our school and learning environments safe. Here are some adjustments we're going to make at Argos to keep our schools safe. This is not the entire list, but it is a start to our list, and it keeps developing as we continue to work further to make sure our schools are safe for staff and students. First of all, adjustments. We're going to rearrange our classrooms and open up our classrooms, set up for greater space between students so we can social distance in our classrooms. We're going to be changing our methods of instruction so students can socially distance and be mask-free if they choose in the classrooms. We're going to reduce the number of people students interact with on a daily schedule, on a daily basis, to reduce risk to our students and to our staff. We're going to implement measures to decrease students congregating in one location. For example, at the beginning of the school, our doors will open. Students are going to be required to go straight to their first period assignments. We're going to spread them out in the building, get the kids in the rooms they need to be so we can do additional screenings. We won't be allowing social times like in the commons and at the locker areas or waiting in hallways until bells ring. We want to get the students in their rooms, get them socially distanced, and getting the day started as normal as possible. We will be looking at socially distanced seating in our classrooms, all students facing the same directions in our classrooms, and we'll be also placing social distancing reminders such as distancing tape on our floor to remind students and staff of appropriate separation spaces. We're going to reduce the amount of materials that are going from hand to hand in one student or one person or not, and we're going to reduce personal belongings going back and forth coming from school. Reducing student exposure to high-touch shared resources at school we'll be working on. We're going to work hard on hygiene at school. Argos schools will consist that all employees and students wash their hands often. And if soap and water are not readily available, we will have hand sanitizer stations throughout the school that contains at least 60% alcohol to sanitize our hands. All schools, all Argos schools, all classrooms, all areas will incorporate key times into the school day when all persons will be washing their hands. Reinforcing healthy habits regarding hand washing is expected, and guidance can be found, and we'll have a link on our website where guidance can be found. Some of the times when we will be washing our hands, there'll be many other times, but these times for sure, start of the school day when we enter the school building, before we go to lunch and after we have lunch, after using the restroom, after blowing your nose or coughing or sneezing, after using shared equipment, after playing during the recess time, and we'll also be disinfecting our recess equipment after each playground use. Going to take many steps to keep our students and staff safe and healthy. Our traditional water fountains will not be operating when students come back to school. We will have our water bottle fill stations accessible and ready to go, so if students bring a water bottle, they'll be able to fill that water bottle hands-free without touching the water fountain. And we'll also have disposable cup dispensers at each water fill, so there won't be repeated touching and repeated use. Surfaces and student hands will be cleansed after getting drinks and after using these situations. The current CD guidelines for public schools recommend the wearing of masks when we cannot socially distance in schools. However, we also realize that parents and students have freedoms and are empowered to make their own decisions. And many people feel very strongly on both sides of the issues whether students should wear masks or not wear masks. At Argos schools, we will be encouraging and highly recommending students and staff wear masks when they cannot socially distance. But it is our goal in our classrooms and at recess and at lunch that we will be able to socially distance and masks will not be required. We will be cleaning the school at an ever increasing rate. High-touch objects and surfaces will be cleaned more often and more vigorous, and the whole school has been highly disinfected. It will continue to be highly disinfected, so we'll be ready for the open of school. Students and staff will be cleansing desks and frequently touched objects such as desks and tables at the beginning of each new class periods as students rotate. Our air filters are being changed constantly, and we are repeatedly bringing in fresh air and frequently bringing it in from the outside, pushing the air that we're breathing out of our building and bringing in fresh outdoor air to be as safe as we possibly can. Next stage I'd like to talk about is in our school building again, and health at school, but looking out how we can provide nutrition to our students and staff in a safe manner. Once again, it begins with hand washing hygiene. Prior to any meal service and after any meal service, all students and staff will utilize our hand washing with soap and water or our sanitizing stations to ensure safe eating practices. We will have some food service changes. Options that will be included. There may be other options. Keeping all lunch groups scheduled with social distancing. So we'll be spreading out. We'll be sitting distance separation in our cafeterias. We'll use areas like the deck in our main gymnasium to separate people out, or in rooms that we're not currently using as classrooms we'll set up. But we want to separate our students out as much as possible with the 6-foot distancing so they can eat in safety without having to worry about masks or being socially distanced. We're going to change the way meals are served. We're going to serve our meals in all disposable products. Disposable food containers, disposable plates, disposable napkins, disposable silverware until further notice. So after we consume it, it won't be touched by many other hands. It will be disposed of. And our kitchen staff will be using PPE equipment for safety in preparing the food and serving the food to further protect our students. The environmental risk protection, we're going to employ socially distancing methods with our staff and students, as we mentioned. We're also going to put tape marks in the floor as we move down hallways. We're going to do some one-way direction in the hallways and our seating adjustments in our classrooms, all to get the space needed so our students can have as normal day as possible, but being safely social distance in our school buildings. Next topic I'd like to talk about, a very important topic, is our transportation system. How do we safely get our kids to school on school buses? I know many of you, many of our students walk to school. Many of our parents deliver our children to school. Those areas will be looking different. We don't want people to congregate in front of our doors. We don't want people to stand in line. When people come, we will want them to enter the building, our students, and go straight to their first period assignments. And we would really ask the cooperation of parents in dropping students off, to drop them off on the sidewalk. We will have staff there to get them in the building, but not to overcrowd our hallways and our entrances, so we can maintain social distancing at the beginning and at the closing of school. Our school buses are often the first point of contact for our students in the morning, and we will be using proper protocols with our bus drivers. All our buses have been cleaned and will be cleaned after every route and before students enter our buses. Our bus drivers will be wearing mask shields or masks or shields to protect from students entering the bus. Now, when everyone's seated and we can social distance on our buses, the bus drivers, it's going to be optional where they wear masks. But as soon as they're getting on or off the building, we are going to require our bus drivers to have a shield or a mask. We will also be having our bus drivers observe if there's any symptoms being exhibited by any of our students, and we'll also be observing our drivers to make sure there's no symptoms or we need to exclude those people from participating. Students may be restricted on riding to their assigned bus only. We will attempt to social distance on our buses, like family can sit together, but we will skip seats and alternate seats to get social distancing on our buses. We may have to adjust some of our routes, and physical distancing will be our first line of safety on our buses. If we get in a situation where we can't really physically distance on our bus, the bus driver will announce that they recommend the students put on a mask because we're not capable of social distancing at this time. As much as possible, we're going to try to social distance on our school buses. Another topic we've been asked a lot about, what about our extracurriculars? What about our sporting events? What about all our activities? We will have a link on our website that ties into the Indiana High School Athletic Association, their guidance on this, and how we are going to open up with our extracurriculars. Several points I'd like to share that will be implemented as we implement our extracurricular schedule. First of all our summer activities are optional, and that's per a state guideline. Activity and extracurriculars will in all instances follow the state's phased-in approach. So whatever the governor of the state of Indiana says, whatever the Department of Education says, whatever the Indiana High School Athletic Association says, Argos schools will comply with whatever guidelines we're getting from the state of Indiana. All participants in our extracurriculars will be screened and must be symptom-free in order to participate. So symptoms again, we'll go through them. A fever of 100.4 or higher is an exclusion. A cough, a shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, a new loss of taste or smell. These will be eliminations, and we'll follow the isolation quarantine guidelines if any of our participants, athletes, coaches, anybody shows symptoms in these areas, just to make sure we are keeping everyone safe as we go ahead with our athletics and our extracurricular assignments. Individual sports have different levels of contact, so our coaches with our athletic directors and our principals will be giving further guidance for each individual sport as we move forward. Next topic we'd like to just touch on a little bit is in the school building again, health at school. We have some special situations. I know many of you are thinking, well, my child or my children have special situations. And we very much are aware of that and want to provide for children that have special requirements or special needs. We at Argos Schools are committed to accommodating and be flexible to meet the needs of these children. We understand that we have special education children with individual learning plans. Argos School is going to make every attempt to provide safe and secure public education for these children as we implement their individual learning plans. We know we have children with 504 conditions. We will implement those 504 conditions. We will be working with parents in special education 504 conditions to make sure that we are keeping your child safe and providing for the needs of your child. So the words I want to stress again, I've said them several times, I'm going to repeat again. We need to keep the idea, how can we be flexible? How can we accommodate? But most of all, how can we keep everyone safe as we're providing a quality education for our children? So if you have questions or concerns about special needs of your children or special exceptions for your children or just questions at all, we have on our website a contact, questions@argos.k12.in.us. Any comments or questions put on that website, put on that link, we will answer, we will get back to you, we will work with you to provide for your children. As I conclude as superintendent, I'm really proud of Argos Schools and the way Argos Community Schools have pulled together through this pandemic. And I'm really proud the way we learned on the fly to have over 2 months of e-learning that was never designed to deal with the pandemic. It was designed for a snow day or a professional development day. But students learned, staff learned, parents learned, and everyone cooperated and worked together, and we successfully completed last school year. As we go forward, we're still studying how to improve our distance learning and our e-learning, because we realize this could happen again. We could have to close school for a periodic time, and we want to keep our distance learning going. It is realized there will be some students that have serious medical conditions that may not be able to come back to school and may have to continue their learning at this time, part-time in school or online. We're going to provide and we're going to accommodate. So it's a changing situation. We need to be flexible. We need to accommodate. But most of all, as superintendent of Argos Schools and speaking for the Argos Community Schools Board of School Trustees, we are committed to provide a safe and quality education for all of our students. Thank you. We will be in touch. This will all be posted on our website for you to review. But let's look forward to opening schools on August 6th with Argos Dragon Pride. Thank you.